We make it short. We have got 2 talks. I promise you on Thursday, trauma, we will not miss it because we know the social event was more important than give a trauma lecture, but trauma is still on the agenda. So in this study, we will talk about toy or tool II in ultrasound. When we use this option, we thought we would like to focusing with breast because there are already available AI algorithms on breast imaging, and I'd like to prove it with you together whether it's working or not. We know that breast cancer is the second common most cancer in the world, and then we know also that a lot of cases, and unfortunately, a lot of women will die. So therefore, we need some better option to make a clear definition, is it a benign or malignant lesion? When we speak about AI, you see nearly every company speak about AI. You see the Philips company, Siemens company, and there are tons of companies which tell you we have got AI algorithms available. What does it mean? Sometimes they speak about artificial intelligence, sometimes they speak about deep learning, machine learning, pattern recognition. So there's a huge magic box, and at the end of the box, there should be a result which should be improve your daily work. When we look at the FDA definition regarding AI, it means it's a machine learning, it's an artificial intelligence technique that can be used to design and train software algorithms to learn on data. Is this really true? Yeah, I think that's true, because at the moment, together with the Charité, a huge university in Berlin, we are collecting tons of data for liver lesion, because we would like to use also AI in contrast and ultrasound. Therefore, you need probably more than 400 cases and videos to give the computer an option to be trained. And we cross our fingers that maybe next year we can show our first results regarding AI and liver lesion. You see, there's a training phase. For example, in this case, it was breast. They've done more than 10,000 cases to get this algorithm. And you see how difficult it is, a lot of pathways. And at the end, we would like to get a final diagnosis. So for us, we received an image, and afterwards, this algorithm should tell you, is it probably benign or is it probably cancer? Is this already available? Yeah. So you see, we're using the breast settings, then we just push on this lesion, so the border of this lesion will automatically detect it. You could choose whether it's fine or not fine, and you can optimize it, and it gives you an answer, probably benign. I think that's not too bad. Of course, if somebody tells you it will work, you have to prove it, because I tell you a lot of stories, and sometimes it doesn't work in your daily work. So what we have done, we have using the RS-85 system, which is a commercial available system. And with this system, there is a base algorithm already installed. This algorithm works on breast and also works on thyroid already. So you can buy this algorithm, which tell you benign or malignant. They say every time possible, because if they make a clear definition, benign or malignant, they have some problems if they are wrong, because you should be the one who makes the final decision. But we check, how is this algorithm? So we all know cystic lesion. We see a nice bottom artifact in the cystic in the strain imaging. So from us in grayscale, we probably say this is just a breast cyst. So you see, I mark this lesion. So it tells you the echogenicity of this lesion. It describes automatically the shape of this lesion, and it tells you automatically probably benign. I think it was a warm-up case. It was an easy one, but it works for the easy one. Okay. I thought, okay, we go now to a more complex lesion, because you see, this is also a cystic lesion, but the surface is completely different. The shape is different. It's much smaller. It doesn't have this strong dorsal enhancement. So we check it again. So it detects automatically pretty good the border. I don't change anything. It describes the shape, and it also tells you probably benign. So even in a more complex cystic lesion, it works. So I thought, okay, now we make it more difficult, because you see it's also a cyst, but it's more complex cystic lesion. There's also a vessel. Does this maybe have got an influence on the diagnosis of this program? You see the shape is detected automatically, and it tells you also probably benign. Here are the virus classification. You see also what's the ranking there. Then I thought, okay, it seems to be cyst working, so we have to look something which is like a complex cystic lesion. So we find a lesion here, there with some tiny vessels. And this was not a cyst, it was a fibroadenoma. But you see also it was detected, even it's not complete echo-free inside, it tells you probably benign. So fibroadenoma working. Then I choose a bigger fibroadenoma. In strain imaging, you see the intermediate stiffness between soft and hard. This works pretty good for fibroadenoma because breast cancer are much harder. And it looks for the shape, it describes everything, and also benign. So we have a couple cases which we was on the correct side. Is there any hook? Maybe we try it with some cancer. You see a little bit more difficult, the shape is completely different, the vascularization is different. Again, we're using the algorithm, you see the shape is detected, and it tells you probably malignant. Yeah, it was confirmed, this was ductal carcinoma. Now I tried some challenging cases. You see this lesion here, what it is? That's the question. It doesn't show major vascularization inside. There's some vessel in the peripheral here. I'm going back. So probably it tells you probably malignant. So we biopsy also because also in grayscale it looked like malignant. This was a hematoma. But this is, of course, a challenging case. What about this lesion? This looks also very, very strange. And also this lesion, they said probably malignant. This was the final diagnosis, abscess inside. But of course, if you correlate the patient information, probably you could rule out these problems. But if you summarize it, you see an advantage. There are also already some studies already. So this program is pretty good if you have got less experience. It will improve your the sensitivity and specificity of your diagnosis. If you are an expert, you probably don't use it. But sometimes if you like to have a second opinion, also on the study, you see there is an improvement if you use this tool, especially if you're not so have not so much experience. Also here, there's a couple of studies with about 120 cases. In this case, they won't include 65 malignant liver lesion and breast lesion and 54 benign lesions. And if you see the curve, also very promising. In summary, in the study, they said that SDTech can improve the specificity and positive value and the accuracy of breast lesion. And you see this was the first generation of this algorithm. That was 5 years ago, but nowadays they're getting better and better. So in summarize, when we speak about our personal experience, advantage, it's directly available on your system, on card. You don't have to transfer any data to a computer. This is a big advantage. It's not time consuming. This diagnosis takes you less than 1 minute. You just put it on with your finger and get directly the information. Sometimes it is helpful if you need a second opinion or if you have got less experience, then it's train also you. But the final diagnosis has to be done by the doctor because this doctor is responsible and not the system. They say only probably. It's also similar available for Tarid. And also, we like to have it also for cardiac diagnostics. This will be work in progress. So they work on it to bring it also. For thyroid, it works very similar. We also have proved it. So with this short talk, what's your opinion? It's a tool or a toy?
Well,
both, yeah.
The mammograph would be absolute first ultimate diagnosis.
Yeah.
Not ultrasound.
I mean, in mammograph, they also look for calcification, microcalcification. They have good algorithm which detect this.
In Denmark, mammography as one of the
Screening stuff.
Review is already started. The systems already in place that are reviewing one radiologist, one AI, and so it's already here.
Yeah, yeah.
but in the moment they are intending to add contrast mammography, and so they are not satisfied where we are, particularly with the express. So it's still a search